prosthodontist is a dentist who's had 5 years education and then has specialized in restorative and reconstructive dentistry. So that takes approximately 3 years. It's a peer-reviewed situation, so that means that we're constantly being examined and challenged by the best of the best in our specialty and also in other specialties. And at the end of 3 years, you have to pass a set of exams and, in fact, publish a paper. After graduating, we all continue to do lots of ongoing education, and that's over a broad number of topics, not just prosthodontics, because it's really important to know what's out in the market and to be current with the latest techniques and materials, and also to be current with who can provide those services when they're appropriate for our patients. So, for example, last year I spent about 200 hours in continuing education, and the legal requirement is to have 50 hours in 3 years. So there's a lot of investment in staying current and knowing what can be done. A prosthodontist is, I think, two things. They're a strategic planner and they're a risk assessment specialist. So it means with those two skills, we can have a much better overview of what's going on in a patient's mouth and with their teeth. And it means that we're always considering what could go wrong, how we could avoid those risks, and how we could make the situation last longer, look better, and feel more comfortable. So that means we need to work with a high standard of precision. We use excellent supporting team members, the ceramists and the technicians that provide the work. And I think as a consequence, we have a higher quality product. It fits better, it lasts longer, and we have less complications. So the benefit of this sort of an education is that the treatment we can provide means less unnecessary treatment done efficiently. Treatment with a prosthodontist therefore means that you're going to have a more controlled situation, problems have been anticipated in advance, and you should have more confidence that your teeth will look better, will look very natural, will be very comfortable and work well for a long period of time. So basically that you get value for your investment and that you get what you want, that you're not disappointed with the outcome. So the treatment is appropriate and it's of a higher standard than you would normally get at your general dentist. When you come to see us, we do an initial consultation. It's 90 minutes. It's incredibly comprehensive. We're going to look at not just your teeth, but we're going to look at how attractive or unattractive your smile is, identify the problem areas, whether it's the gums, the teeth, and just look at every aspect of your smile and mouth. Our normal consultation process involves 3 appointments. The first appointment is to obtain all the information we need. What's happened to you in the past, what treatment has been provided, has it worked, what were your issues with it, where do you feel things went wrong, and what you'd like to achieve. We look very comprehensively at your teeth, your gums, your smile, and at your dentures and any artificial teeth that you might have. And then at the end of that appointment, we'll have a general discussion on what we think might be available to offer to you. Some people then need to go on and have additional information such as x-rays, CT scans. We often need photographs just to have a look and really assess these issues more closely. And the final point of your consultation process is an appointment where we sit down and discuss what can be done in your situation. So for a limited time only, we're offering the consultation for free. It's excellent value and it may make a huge quality of life difference as well as a big saving to you in the long term. We'd encourage you to contact our rooms and take up this offer for the limited time that it's available.